Segment sponsored by Shoppers Food and Pharmacy.
So we've been telling you all about this year's Be More Healthy Expo, and while you may think of Shoppers Food as your neighborhood grocery store, Shoppers also offers many resources pertinent to your health and wellness that you may not be aware of. Dr. TJ, Dr. John from Shoppers, along with Leah from UMMC are here to tell us more. Thank you so much for being with us.
Thanks for having us again.
Of course. Yes. So there's something at Shoppers called the My Diabetes Coach Tour. Tell us what we can expect when we go on that tour.
Sure, Leo, go ahead.
Okay, so when you get to the Shoppers tour, you are going to meet with a pharmacist, a wellness pharmacist, and a dietitian. We'll meet with you, go over a few things, and then you can expect to be on the tour for about an hour to an hour and a half. Okay. During that tour, we really like it to be participant-led. Everyone has different questions about nutrition, but we have a lot of things that we also like to talk about. Right. Label reading is one of the big things we like to talk about, and just kind of food myths. As it pertains to diabetes.
Yeah, and there are a lot out there. So you mentioned label reading, and you're going to show us how we can properly read labels and what we should be looking for. So what are the important things?
So as far as diabetes is concerned, we really want to make sure we're paying attention to serving size. A lot of times when you're reading a label and you are comparing two things, you don't always look at serving size, and that's really the most important thing, because you could be comparing one slice of bread to two slices of bread. So with that, we're going to actually take a look at two different loaves of bread. Okay, so one of them is a Shoppers white bread, and one of them is actually a Shoppers wheat bread. As you can see on the wheat bread, I believe both of these are one slice per serving. But the next thing we want to look at is carbohydrates. Okay, so mine says 16.
Okay, I have 12.
12, okay, and that's actually with the whole wheat. The next thing we want to look at is fiber. So fiber is what's going to keep us feeling fuller longer. It's also going to, it's great for our health, so we really want to make sure that we get enough fiber. Over here it looks like 2 grams of fiber, whereas the white bread has less than 1.
So this is going to help keep you full longer so that you're not feeling like you need to snack immediately after a meal.
Exactly, and it's also going to help to just digest a little bit slower.
Okay, cool.
The other thing we're looking for on that bread is 100% whole wheat. So whole wheat flour is actually the first ingredient, whereas enriched flour is the first ingredient here. So this would be our choice.
Gotcha. So go with the whole wheat every time, guys. So tell us about what our plate should look like, because I know even recently the pyramid has changed. Now we're looking at a plate. What should we look at specifically if we have diabetes? What are the things that we want to focus on our plate?
Yeah, so we actually brought along a dinner-sized plate today, and we'll kind of make it for you. So what we're looking to do is make half our plate non-starchy vegetables. Okay. Non-starchy vegetables are things like lettuce, leafy greens, broccoli, tomatoes, peppers. The other thing we want to do, and so I'll kind of make it a little bit here. Thank you. Okay, so just about half our plate. It's a little messy there, but and then we're going to add a quarter grains. It can be grains like whole grains like brown rice, whole wheat pasta, which I thought we brought along here. We can also have starchy vegetables like potatoes, corn, peas, sweet potatoes, that kind of thing. We're aiming to make a quarter of our plate. That's where our carbohydrates are going to be. So with a diabetic, it's important because we're watching our carbohydrates.
Definitely.
Okay, so it's about a quarter.
Yeah.
And then last piece is we want to add some lean protein. We have some chicken strips here, so I'll add those.
So we have about a quarter grains, a quarter protein or meat, and then about half should be vegetables.
Exactly. And feel free to add more non-starchy vegetables to that salad.
Yeah, load them on. They're always good for you. So doctors, tell us a little bit more about the Shoppers Pharmacy. There are some follow-up activities that you guys go. You make sure that you're following up with people who go on the tour. Tell us more about that.
Yes, there are. So after we go on the tour, we will have a class with everyone that went on to the tour where we'll go over and we'll just start with the basics of what diabetes is and how to give them the tools to empower them so they can use all of that and what they learned on the tour by themselves.
Right.
Following with that, then we'll have 2 individual classes, one-on-one classes, and that can be from medication to simply even more learning about what they're eating and that sort of thing.
That's wonderful. And you guys, of course, are going to be at the Be More Healthy Expo that's coming up this weekend. What can we expect there?
Well, we're going to have Leah and her team. We're going over all the nutritional aspects, but we're going to have the whole pharmacy team there, checking people's blood sugars, going over proper diets, questions about their medications, really a full good product to make sure that people understand their medications and their health.
That's wonderful. And of course, you checked my blood sugar. It's really easy, guys. Definitely go do it. Stop by the shoppers table at the expo. Where can we go to find more information if we have questions about the pharmacy or the diabetes programs?
Sure, good question. So what you could do is actually just go to any of your local shoppers that has a pharmacy. The pharmacist will be there to help you with any questions that you do have. And it's important to note that, especially for our diabetes patients, we do offer a free A1C with these classes. So that's going to be kind of their baseline. And then when they go through the classes, we will give another A1C to see how they have progressed. And then A1C is just kind of an overview last 3 months of their blood sugar. So it is important.
Very good.
Yeah.
Keeping up with your health and wellness. Thank you so much for joining us. We're looking forward to seeing you at the expo.
Thanks for
Thank
having
you.
us.
Of course.